applicants get full access to the health care they need. She advocates for her individual clients and overcomes systemic healthcare barriers affecting all Californians. Community Legal Aid SoCal is a proud member of a statewide collaborative of other legal aid agencies as well, called the Health Consumer Alliance. Joan is a member of the Health Consumer Alliance's Race and Equity Committee. She received her JD from Southwestern Law School and her BA from University of California, Berkeley. She is also a proud mother of 2 young children. So everyone, if we can all welcome Joan Chang. Thank you.
Hi, again, my name is Joan Chang. I'm a staff attorney here at Community Legal Aid SoCal. I just wanted to provide you guys some hopefully practical information for yourself, your family members, friends, and the larger community to hopefully be able to inform them and make sure they make informed decisions regarding the healthcare rights, especially during this funky public health emergency that we're all going through. So let me pull up my slides here. Okay, all right. Like I said, I'm from Community Legal Aid SoCal. Who we are as a larger organization. We were founded in 1958. Community Legal Aid SoCal provides free legal services to low-income families, individuals, and senior citizens, both in Orange County and Southeast LA County. Our mission is to essentially help our neighbors fight injustice by providing compassionate, high-quality legal aid and advocacy for making sure our communities remain strong and informed. Our Community Legal Aid SoCal provides a wide variety of services through a multi-tiered delivery system that consists of public education, an intake, which includes our toll-free legal hotline, self-help services and clinics, and direct representation. Our clients include residents whose human rights and basic needs are jeopardized and for whom significant barriers to justice unfortunately exist. Nearly all of those who we serve are otherwise unable to afford or obtain legal counsel, including low-income individuals, individuals experiencing homelessness, seniors, victims, and survivors of human trafficking. Also survivors of domestic violence and those experiencing racial and ethnic discrimination. Our hotline enables our callers to begin solving their legal problems by offering immediate legal advice, information, and referrals. With clients with complex cases, they may be enrolled into clinics or have office appointments with individual one-on-one attention. Our office hosts attorney-led self-help clinics, and through our offices in Santa Ana, Anaheim, Compton, and Norwalk, we're able to provide free legal services to thousands of eligible clients, again, both in Orange County and LA County. Specifically in LA County, it's Southeast LA, and I believe our service area covers 22 cities within that area. Again, our legal services are for free because of the pandemic. Our physical offices are closed at this time, but everyone is accessing all of our legal services through our hotline, and that's how folks get to us normally, even pre-pandemic. So folks could just call our 1-800 number, just answer a series of intake questions and then specific questions regarding their legal needs. These are the legal practice areas that we serve. Essentially, just a note, we don't assist with criminal matters, but we would provide referrals if folks do call in regarding personal criminal matters. I am specifically in the health unit, the Health Consumer Action Center, and I'll be describing what sort of services we provide within the Health Consumer Action Center within Community Legal Aid SoCal. So we, as health advocates at the Health Consumer Action Center, we assist with eligibility benefits. We actually are the One Care Connect ombudsman. I'm not sure if any of you are familiar with this program, but it is the Cal MediConnect plan that's in Orange County. Essentially, it combines folks' Medi-Cal and Medicare together under one plan. So hopefully it's supposed to be seamless, but oftentimes there are issues and hiccups that do come about. So that's why we serve as an ombudsman to kind of make sure those hiccups are smooth. We assist folks with issues regarding eligibility for Medi-Cal, IHSS, which is in-home supportive services, Medicare eligibility issues, Cover California, and private insurance and other health coverage. We essentially assist folks with obtaining health benefits that they're entitled to. So oftentimes folks are receiving denial notices from their health plan saying, oh, we don't believe this particular treatment or this particular medication is medically necessary. And so if we feel that there is some, documentation of medical necessity, then we would be able to represent these folks in appealing those denials. These denials can include things like surgeries, treatments, testing, medications, DME, durable medical equipment. In the past, our health advocates have assisted folks in successfully appealing wheelchair denials, stair lifts denials, leg brace denials, things of that nature. We also assist folks who are being denied referrals to specialists, because sometimes health plans will go ahead and say, oh no, we think you're fine and dandy essentially, and you don't need to see these particular specialists. So we've been successfully able to overturn those health plan denials and making sure our clients get the healthcare that they need. And in particular, we actually we've been quite successful in this particular area for ABA therapy. ABA is applied behavioral analysis therapy for autistic children and adults. Unfortunately, Medi-Cal managed care plans have kind of routinely cut a lot of these therapy hours for Medi-Cal autistic patients. And so our office has been pretty successful in this particular arena in being able to restore or even increase their ABA therapy hours. And lastly, we do assist with dental services, access to dental services, denials of dental services by Denti-Cal/Medi-Cal. As I previously mentioned, we do assist with in-home supportive services. If you have a client or family member or friend whose IHSS hours were cut, we could help file an appeal and represent those folks at state hearing. Lastly, we do assist folks with improper medical billing. We can review folks' medical record or medical bills to see if they are actually being properly billed, and if it is determined to be improper, help to discharge the bill, or if necessary, appeal the health plan's denial of paying for the bill. So who we serve specifically in the health unit, the Health Consumer Action Center, we do serve a broad spectrum of clients. Low-income populations are kind of our priority population. However, our specific health grants allow us to assist folks at all income levels. We do serve the monolingual populations. In the health unit, we specifically have staff who do speak Vietnamese, Spanish, and Korean, but we do have interpreting services in all threshold languages through our language line. We assist clients of all ages, from children with special needs to vulnerable seniors. We assist those who are disabled, those with both mental and/or physical disabilities, including those who are visually and hearing impaired. As previously indicated, we do assist clients who are on the spectrum. We assist developmentally disabled folks, both minor children or adult children, current and/or former regional center clients, and their parents. We do serve the LGBTQ+ community. We serve those with chronic medical conditions, but we also help folks who are healthy and essentially just looking for what their healthcare options are. And lastly, we do assist those living in long-term care facilities and family members of those who are. Again, some of our success stories, I think this needs to be updated, but I think at this point we've restored eligibility for probably over thousands of Medi-Cal patients, of Medi-Cal clients. We've been able to be pretty successful in the durable medical equipment arena, like I said, overturning some wheelchair denials, leg brace denials, hospital bed denials, things like that. And we've saved, I want to say we've maybe even reached up to 1 million at this point in time, but just to play it safe, we've definitely saved our clients at least hundreds of thousands of dollars in inappropriate medical billing. All right, so let's go into COVID specific stuff here. As all of you probably know, the vaccine has now been extended to anyone age 16 and older, essentially based on supply. Here are some various ways for folks to be able to access a vaccine appointment. Our particular office are assisting folks who are experiencing any sort of language barriers specifically, or any sort of technology barriers to accessing the vaccine appointments. Because in the past, I know the Athena app at one point in time was only available in English, but I believe it's been translated in several other languages at this point. So if you guys have any family members or friends or anyone you know in the community who are experiencing tech barriers or language barriers, please have them call our hotline. Keep in mind, I'm sure you guys know this already, but the vaccine is free. There's no cost sharing, no co-pays. You don't have to be insured. You can get the vaccine no matter what your immigration status is. And if you do have Medi-Cal, you can have CalOptima, the managed care plan, arrange free transportation to and from your appointment. So the question is, do I have to pay for COVID testing? No. For private plans, Medi-Cal or for Medicare, you do not have to pay for any cost sharing, co-pays, things of that nature. If you have anyone who has perhaps a shady provider who is attempting to charge for the COVID vaccine, send those folks over to us and we'd be able to address the matter, because that should not be happening. Essentially, for private plans, there's no cost sharing. You don't have to get a prior authorization for the test. And for private plans that are regulated by the Department of Managed Healthcare, they've eliminated medical requirements. It used to be that you perhaps had to have been exposed to or exhibit symptoms to get the test. But now at this point, even if you just want to ensure that you don't have the virus before you visit a family member, you could get the test for free. For Medi-Cal, unfortunately, they still are counting, they're still considering the medical necessity standard. But we've been kind of told by DHCS, the Department of Healthcare Services, which is the state agency that regulates Medi-Cal, we've been told that folks should be able to access COVID testing fairly easily. So again, if you guys know of any family members or friend or community members who are experiencing any sort of issues in accessing the COVID test as a Medi-Cal recipient, please send those folks over to us and we'll be able to address the issue. For Medi-Cal specifically, no prior authorizations are required, and they do limit, unfortunately, the testing 2 times per day. For Medicare, you don't have to pay any sort of testing or any sort of co-pays or co-insurance, anything like that. And specifically, Medicare does cover the antibody or serology tests. So the next question is, do I have to pay for COVID treatment? With private plans, the answer is maybe. Private plans are technically able to charge the cost sharing and co-pays or co-insurance that would normally apply. Say, for example, you had like a 10% co-insurance for hospitalizations. Technically, if you were hospitalized because of COVID, the private plan can still charge you that 10% co-insurance. But a lot of private plans are waiving all cost sharing, all co-pays, all co-insurance. So it may just depend on the plan. I actually assisted a client recently who was charged that I believe like a 20% co-insurance for a COVID hospitalization erroneously, and we were able to get him a reimbursement for that 20%. I believe it was HealthNet. HealthNet, I believe, is waiving all cost sharing. Medi-Cal does not charge for any sort of treatment. All medically necessary COVID treatment is available at no cost. For Medicare, unfortunately, any sort of COVID treatment, folks still have to pay the co-pays and co-insurance that apply in regular Medicare. So that is typically the 20% co-insurance. So typically Medicare folks will unfortunately still have to pay that 20%. However, there is a COVID-19 uninsured group program. This is a program that's provided by the state, by the Department of Healthcare Services. And essentially it's for those who are either uninsured or underinsured. And they provide both screening, testing, and treatment for free. Essentially, there are no income requirements, no resource requirements, no immigration status requirements, and it actually can be made retroactive to April 8th. Actually, us as consumer advocates, we try to make it retroactive to March when the pandemic first hit, but the state unfortunately wouldn't budge on that point. So essentially, even if you have folks who have private insurance, but they had to pay some sort of co-insurance for their COVID treatment, they can enroll into the COVID-19 uninsured group program and get essentially the state to pay for their whatever it is, 20% co-insurance, 10% co-insurance, whatever it was out of pocket that they had to pay. And essentially, you would have to call this number to be able to enroll. There's only certain enrollers for the COVID-19 uninsured group program. Specifically for those who are Medi-Cal recipients during the public health emergency, there is a moratorium on negative actions, meaning folks essentially cannot be cut off from Medi-Cal during the public health emergency. Just as a background, there are some folks who have free Medi-Cal and a share of cost Medi-Cal, but essentially during the public health emergency, folks' share of cost cannot go up. Folks who would normally age out of a particular Medi-Cal program cannot do so because of the public health emergency. There's no negative actions when someone adds a household member, and no negative actions if you don't actually pay your monthly Medi-Cal premium. So this is a huge kind of game changer right now for Medi-Cal recipients at this time. Even if technically folks are not currently eligible, they're either over income, over assets, or they have just a high share of cost. None of those changes, none of those terminations can take place because of the public health emergency. As of now, the public health emergency has been extended to July 21st. I believe it gets extended every 90 days. We've essentially it's been essentially hinted by the Biden administration that the public health emergency will most likely be extended through the end of the year. But unfortunately, they can only extend it 90 days at a time. Okay. And what if I cannot pay my Medi-Cal premiums? So there are some folks who are enrolled into Medi-Cal plans where they have to pay a monthly premium. The monthly premium can be anywhere from $17 and up to $375 per month, depending on the particular Medi-Cal program. For those who can't afford to pay for these Medi-Cal premiums right now, they can request for a waiver of these premiums that keep getting tacked on to their bills. For the children, pregnant women programs, they would have to call this number. For the 250% working disabled program, they would call this number. Essentially, though, if anyone's income has dropped, it is advisable for them to contact their county caseworker because they may very well be eligible. Their income may have just dropped enough to be eligible for free Medi-Cal. If you guys, again, like I said, if you have any family members or friends or community members who have Medi-Cal whose income may have dropped, have them call us and we'll be able to kind of reassess their Medi-Cal eligibility to see if they may be eligible for better or cheaper or free Medi-Cal programs. Keep in mind, this waiver actually has to be specifically requested, so it's not going to be an automatic waiver. Folks actually have to call in to request for the waiver. Like I said, this is a pretty valuable benefit right now during the pandemic because, as I said before, Medi-Cal beneficiaries can pay up to $375 per month for these Medi-Cal premiums. And for some of our clients who are quite low income and on a pretty low threshold at the federal poverty level, every dollar counts. So if you guys have anyone that you know who may need assistance in this area, again, please have them give us a call. So will getting COVID vaccines, testing, treatment hurt my immigration status? No. Specifically, the federal government has said that the public charge rules will not apply to any sort of COVID vaccination, testing, screening, or treatment. And more importantly, the Trump administration's updated public charge rule has ended. Essentially, through litigation, the Trump administration's updated public charge rule has been blocked nationwide. USCIS, the U.S. Citizenship and Immigration USCIS Services, is no longer applying the old August 2019 Trump era public charge final rule. In other words, the federal government is no longer considering an applicant's receipt of Medi-Cal except long-term institutionalization. So folks who are receiving Medi-Cal, folks who are receiving public housing, folks who are receiving food stamps, those public benefits are no longer an admissible factor in determining whether or not they get an updated immigration status. I do have to warn folks that the Trump administration's public charge rule had and continues to have a chilling effect on immigrant populations. Many of our clients, even personally, many of my personal clients have, they were just so scared when these updated public charge rules first came about back in 2019. They were so scared of getting Medi-Cal that they even just cut it off. They decided to not essentially make that risk of perhaps having it affect their immigration status in the future. So essentially they went without medical coverage, despite the fact that some of the public charge rules didn't even apply to them. So it's essentially our job as healthcare advocates and as community leaders to make sure we inform and reassure folks to not jeopardize their health by terminating their public benefits, and make sure that they're aware of what their both healthcare and immigration rights are. So dental care, I'm sure, as you know, I'm sure some of you guys have already received, dental care during the pandemic, but dental services are now open for all dental services, including preventative, routine, and emergency services. There are unfortunately still some Medi-Cal dentists who are not opened as business as usual. So if folks are having difficulty accessing a Denti-Cal dentist, they could always call the Denti-Cal number to get assistance in locating an available Medi-Cal dentist. There are some kind of tips and warnings against Medi-Cal dentists. Tip number one is, and this is actually for all dentists, not just for Medi-Cal dentists. No dentist can charge what they call like a PPE fee or like a COVID administration fee. That's essentially against policy and against law. If you guys have experienced this personally, or if any of your family member or friends, or like I said, any community members that you know have been inappropriately been charged a COVID or PPE fee by their dentist, send those folks over to us, and we've been able to successfully get those reimbursed for folks. Kind of tip number two, or kind of a warning number two, Medi-Cal dentists may try to upsell you on a dental service that Medi-Cal does not cover. Now, state law has been updated so that Medi-Cal dentists are now required to provide you a written treatment plan that includes both the covered service that's for free through Medi-Cal and whatever upcharge that they're saying is not covered by Medi-Cal. So keep that in mind. A lot of folks, I know of one instance at least where a dentist didn't provide the written treatment plan despite it being required by law. So if like I said, if you guys have any clients in similar situations, please send them over. Tip number three with Denti-Cal services, Denti-Cal now has what they call a dental case management program. It's a program that's designed for Medi-Cal members with special healthcare needs who are unable to schedule and coordinate their complex treatment plans. And it's usually because they involve one or more medical and or dental providers. Case management services are extended for members with significant medical, physical, or behavioral diagnoses. Examples of qualifying special healthcare needs include physical or developmental disabilities, sensory disabilities, behavioral, cognitive, or emotional impairments, or any sort of limiting condition that would essentially require some medical management or hospital dentistry. For example, I've had a client of mine in the past who required having dental services be provided in a hospital setting, in an, I believe it was still outpatient, but it's still in a hospital setting because of his pre-existing conditions. This was a minor child. So those sort of cases, Denti-Cal specifically has this dental case management program to serve those type of clients. Another example is a patient who may require sedation for dental services. So patients like that, again, can call the dental case management program and get some coordinated assistance. And lastly, if you do have a dental appointment and you're a Medi-Cal beneficiary, you can have CalOptima, the Medi-Cal plan, arrange for free transportation to and from your dentist appointment. And that's it. We have a hotline. Like I said, most of our services are, well, we have a website. There may be an intake. I don't know if it's taken down. I have to check, but primarily our clients are accessing our services via our hotline. We have a hotline and it's like, you know, you press 1 for immigration, 2 for health, 3 for, you know, whatever sort of legal services that folks need. And then they get connected directly to an intake paralegal who will ask them further questions, some intake questions, and then some more legal issue specific questions. But yeah, that's how they access our services. And at that point in time, they would get some sort of, at a bare minimum, get some sort of legal advice over the telephone. And if necessary, get connected to a paralegal and or a staff attorney who would be able to provide them a little bit more detailed information or, if needed, representation. Thank you. I don't know if questions came in, Reese.
So far, I don't see any questions in the chat box. Let's wait a moment to see. Well, I'd like to thank you for coming to speak with us today. I hope that for our students out there today kind of brought a little bit more context about some of the intersection with health policy and law, and as well as legal aid. I know that for a lot of this course, we've talked about the different types of medical coverage that a lot of our patients have, but I hope today puts into context some of the resources and some of the legal resources that are out there for patients to have additional recourse for some of their health concerns or abilities to pay for insurance in this case. I do have one question related to some of the Trump era's public charge. How did you note, was that in terms of when he made the public charge announcement, did you see a significant change right away in how your clients approached you, and also if they were approaching you at all, or was it something that was a little bit more gradual? And additionally, how did previous legislation from prior administrations kind of re-up those sort of fears from what you could see?
I mean, so I'm not an immigration attorney, I'm not a health consumer attorney, but from the health consumer point of view, it scared a lot of people. Folks, the Spanish speaking communities, the Vietnamese speaking communities, they would read in their local newspapers, or how they would get their news, all about the scary Trump's public charge changes that he was going to make to the law. And honestly, it was a lot about misinformation, but I think that was kind of the point for for perhaps the prior administration's reason in wanting to change the public charge rule, was to scare folks. Like I said, I've had clients who were essentially thinking about terminating their Medi-Cal, even though the public charge rules didn't even apply to him. Because he was just that scared, and scared for him and for other family members other family members were sponsoring. And so it definitely still has a chilling effect, because even though the public charge rule has been blocked nationwide, it's still scaring folks. And I don't know if necessarily the message is the correct message and the correct kind of information is getting out there to immigrant populations. And so that's kind of our job. Our immigration unit has done several presentations trying to make sure people are now aware of what the rules are. And essentially, the rules are just going back to what the old rule was. So, folks receiving public housing assistance, folks who are receiving food stamps, folks who are receiving Medi-Cal, Medicaid, those folks don't have to worry about those receipt of public benefits being a negative factor in their future immigration status.
Thank you.
That answers your question.
Thank you.
And honestly, I think in terms of other administrations, I think there's some hope that with the Biden administration, obviously, I think whatever the opposite of the chilling effect is, the warming effect of Biden coming in and kind of making sure that I think one of the first things he did in the first couple weeks of his administration was basically the first step in trying to eliminate the updated public charge rules, and having his administration look at what was going on with the updated public charge rule. So I'm hoping that there's now a warming effect with the new administration with some of these immigrant populations. Any other questions? I should include my contact information. If you guys have any, again, folks could access our services through a hotline, but if folks just want to contact me directly, I'm more than happy to chat with folks. And like I said, let me include my email. Community Legal Aid SoCal has income and asset requirements. Our clients typically have to be below a certain federal poverty level. But like I said, for health, to access the Health Consumer Action Center services, we don't have any income or asset requirements. So yeah, keep that in mind. We do have clients who are fully employed and just having issues with their employer-sponsored coverage. That's my contact information. If any of you guys want to contact me directly with questions, but like I said, we're all working remotely from home, but I feel like we're getting more callers now because folks are now realizing that they now they're kind of getting back to a little bit of their normal lives and realizing they kind of need to address some of their legal issues at this point. So I'm looking forward to more calls coming in.
All right, well, if no one else has questions, I think that's going to wrap up this session. Our next lecture is going to start at 2 p.m. And just a reminder for everyone, our schedule did change a little bit today because we incorporated the drug pricing lecture that was supposed to be from 1 to 2 today. We added it onto yesterday's schedule. So our next lecture after this is going to be about social service access in Orange County. And that's going to be an excellent talk that starts in 15 minutes at 3. Sorry, I had said 2. So if everyone wants to just take a bio break and come back in about 10 to 15 minutes, our feedback is now live. So if you go to that same link that we provide for attendance, you'll be able to fill it out there, but I'll copy and paste it into the chat as well. Yeah. Thank you for coming today, Joan. We really appreciate it.
Thank you, Reese. Thank you, everyone. Have a lovely day. Bye.